Hello everyone. In this video we will be talking about abnormalities of the puerperium, and today we will be mostly discussing about puerperal pyrexia, puerperal sepsis, subinvolution, urinary complication in puerperium, breast complication, puerperal venous thrombosis, pulmonary embolism, obstetric palsies, puerperal emergencies, psychiatric disorder during puerperium, and all this thing in brief. And so starting with the puerperal pyrexia, it is defined as the rise in temperature reaching more than 100.4 degree Fahrenheit or 38 degrees Celsius on two separate occasions 24 hours apart, and within the first 10 days, that is within the first 10 days but excluding first 24 hour following delivery, and it is known as puerperal pyrexia. And so that was about puerperal pyrexia, temperature more than 38 degrees Celsius on two separate occasions 24 hours apart, within first 10 days excluding first 24 hours following delivery. And about puerperal sepsis, it is also known as puerperal infection, and we will be mostly talking about this in next video in detail. And this is not called, it is the infection of the genital tract. And talking about when the involution is impaired or retarded, it is known as subinvolution. So what is involution? As we have discussed in the previous video in the normal puerperium. Please write the definition of involution in the comment section. And the causes of and the uterus is most commonly organ affected in subinvolution, and it is the most accessible organ to be measured per abdomen. So uterine involution is considered clinically as the index of to access subinvolution. And the causes of subinvolution is grand multiparity, twins oligohydramnios where there is uterine distension, or there is uterine over distension, cesarean section, uterine prolapse, retroversion after uterus becomes a pelvic organ, and the uterine fibroid, and the maternal ill health. These are the causes of subinvolution, and the symptoms might be and some aggravating factors are like the product of conception and uterine sepsis are the aggravating factor. And the symptom is it may be asymptomatic, the condition, and the predominant symptom are abnormal local discharge, excessive that might be excessive or prolonged, irregular or at times excessive uterine bleeding, and irregular cramp like pain in case of retained product, or rise in temperature in sepsis. And the signs includes that height of uterine height is greater than the normal for the particular ray of puerperium. And talking about management, just increase in size of the uterus is not important, and provided that there is absence of features such as excessive lochia or irregular bleeding or sepsis, the size of the uterus can be safely ignored. But the appropriate therapy is to be instituted only when subinvolution is found to be just a sign of some local pathology. So we have to treat the underlying cause. So just like in endometritis, we have to give antibiotic. Endometritis is the aggravating factor for subinvolution, and we have to do the exploration of uterus if there is retained product, and this is also the aggravating factor of subinvolution. And we have to give the pessary in case there is the uterine prolapse and the cases of retroversion. That was about subinvolution. And next abnormality in puerperium is urinary complication, and the urinary tract infection is one of the common cause of puerperal pyrexia, and the infection may be due to various different causes. The organism like E. coli, Klebsiella proteus, and Staph aureus are responsible, and the retention of urine is common complication in early puerperium, and incontinence of urine is also might be there as a symptom, a urinary symptom. And next complication is suppression of urine. It is also, if the 24-hour excretion is less than 400 ml, the 24-hour excretion for 24 hour, then it is suppression of urine, that is oliguria, can be diagnosed. That is another problem in the puerperium. Then we have another urinary complaint like incontinence of urine. There can be the incontinence may be overflow incontinence or stress incontinence, Nextly, we have the breast complications. The common breast complication in puerperium are breast engorgement, cracked or retracted nipple leading to difficulty in breastfeeding, and the mastitis and the breast abscess. And the lactation, next one is the lactation failure. Four different causes, four different complications in the puerperium. And the breast engorgement and infection are responsible for puerperal pyrexia. The breast engorgement, in here the cause it is due to exaggerated normal venous and lymphatic engorgement of the breast, which precedes the lactation. So this in turn prevent escape of milk from the lacteal system, and the primary patient and the patient with inelastic breast are likely to be involved. And it usually manifests after milk secretion start, third or fourth day postpartum. And its symptoms include the pain, feeling of the tenseness, heaviness in the both breast, and the generalized malaise or even transient rise in temperature, and there may be painful breastfeeding. And the prevention include avoiding pre-lacteal feed to initiate breastfeeding or then unrestricted exclusive breastfeeding on demand, and feeding in correct position and correct latch on, and that was all. And the next breast complication is cracked and retracted nipple. The nipple may become painful in the cracked nipple. That is another complication. And next we have the acute mastitis. The incidence of mastitis is 2 to 20 in lactating and less than 1 in non-lactating women. And the common organism involved in the acute mastitis are Staphylococcus, especially the MRSA MRSA, methicillin resistant Staphylococcus aureus, Staphylococcus epidermidis, Streptococcus viridans. And the risk factor for mastitis are poor nursing, maternal fatigue, and cracked nipple. And its clinical features include the symptoms such as generalized malaise, headache, nausea, vomiting, and the fever more than 38.5 degrees Celsius with chills, severe pain or tender swelling in one quadrant of the breast, and induration. And the signs include presence of toxic feature and the presence of swelling on the breast, and overlying skin is red, hot, flushed, which feels tense and tender. The diagnosis is by microscopic examination of breast milk, showing the leukocytes more than 10 to the power 6 per ml. The complication of acute mastitis is that it can lead to formation of breast abscess. And its management is just like the breast support, oral fluid, and breastfeeding should be continued. Then antibiotic therapy like diclofenac is the drug of choice. And alternatively, erythromycin or clindamycin can be given to the patient who are allergic to penicillin. And antibiotic therapy is continued for 10 to 14 days. And analgesia like ibuprofen can be given. And milk flow is maintained for breastfeeding for the infant. Next breast problem is in lactation failure, that is inadequate breast production. And the normal breast volume is 550 ml per day, and by 2 to 3 weeks it increases from about to around 800 ml per day, and production peaks to 1.5 to 2 liter per day. And the various causes of inadequate milk production include infrequent suckling, depression, anxiety, and reluctance apprehensive to nursing, ill development of nipple, painful breast lesion, prolactin inhibition like due to ergot preparation, diuretic, pyridoxine, previous breast surgery, insulin resistance, high androgen level, and all this cause lactation failure, and that is wrong. And we have to give the appropriate treatment for this problem. Next complication in the puerperium, we have the puerperal venous thrombosis and pulmonary embolism. The basic pathology is explained by the Burchard triad, that is vascular stasis, hypercoagulability of blood, and the vascular endothelial trauma. And the venous thromboembolic disorder includes deep vein thrombosis, that is in the iliofemoral in 70% of the cases, thrombophlebitis, superficial or deep vein, and the pulmonary embolism. Next problem we have in the puerperium is the obstetric palsies. It also known as postpartum traumatic neuritis, and it is the commonest form of the obstetric palsy encountered in the puerperium is foot drop, and it is usually unilateral and appears shortly after delivery or during the first day postpartum or so, and it is thought to be due to It is thought to be due to stretching of the lumbosacral trunk by the prolapsed intervertebral disc between L5 and S1. And its appropriate management include the damaged lumbosacral node is the consultation with the orthopedic surgeon and treating with the for this cause. And next is we have the puerperal emergencies. There are many acute complications that may occur during puerperium, and majority of them are alarming complications. However, following delivery, the complications that arise immediately following delivery are more risky, but the late complications are relatively less risky. The acute complications are the immediate like postpartum hemorrhage, shock, hypovolemic shock, endotoxic or idiopathic, the postpartum eclampsia, the pulmonary embolism like or on air, the inversion of uterus is another complication. In early complications include acute retention of urine, UTI, puerperal sepsis, breast engorgement, mastitis and breast abscess, pulmonary infection, atelectasis, anuria following abruptio placenta, mismatched blood transfusion, eclampsia and decreased milk supply. And the delayed complications include secondary postpartum hemorrhage, thromboembolic manifestation, pulmonary embolism, septic thrombophlebitis, psychosis, postpartum cardiomyopathy, postpartum hemolytic uremic syndrome. And finally, we have the most lastly complication, that is mental health and psychiatric disorder during pregnancy, and the various postpartum conditions like postpartum blues, postpartum depression, and postpartum psychosis are the important mental health problems. And others include bipolar affective disorder, or other known as a perinatal mood and anxiety disorder, obsessive compulsive disorder, and all are these are the mental health problem that is that might occur in postpartum period, and the treatment is psychotherapy and appropriate referral to the psychiatrist or clinical psychologist. So thank you, and that was all about abnormalities in puerperium. And next video we will be discussing in detail about one of the important problem of puerperium, that is puerperal sepsis in detail. Thank you.